Hello guys and welcome back to my channel Man at Anet. In this particular lecture we are going to cover axillary nerve with its clinicals. Okay, now this question is particularly asked in 6 marker also, and it can be divided as 2 marker questions also. Okay, so it is divided into 6 marker, 10 marker, as well as it comes in your university exam as well as your preliminary exams for 2 markers. Okay, now whenever you learn nerves, okay, I have particularly made a video that, and you should definitely watch that video before starting this particular portion. Okay, in that I have taught about the nerves relation to particular regions. Like when we talk about this particular axillary nerve in this particular session, then you have to know that axillary nerve is confined to the shoulder region only. Okay, in the subsequent I'm going to talk about the musculocutaneous nerve. It is confined to the flexor compartment of the arm region. Okay, when we are going to talk about the radial nerve, it is confined to the extensor compartment of the arm region and forearm region. When we are going to talk about the median nerve, okay, then it is confined to certain different regions. Okay, so before starting this particular lecture I would recommend you to go and watch that, because it will make things easier for you. Okay, now particularly in the nerves portion, what do they ask you? They may ask you about the root value for 2 marks. Okay, or they may divide a 10 marker question into portions. Like they may ask you root value, they may ask you its course and relation. Okay, they may ask you about the clinicals associated with it. They may ask you about the branches it gives off. Okay, they may ask you about the muscles it is muscle innervated by it. Okay, so these are the types of things that are generally asked in nerves. Okay, this is going to the pattern with all nerves, whether you talk about the axillary nerve, median nerve, radial nerve, ulnar nerve. Okay, any nerve you ask about it, the pattern is going to be like this only. Okay, so starting with the axillary nerve. So axillary nerve, we know what its root value is. Okay, axillary nerve belong to posterior cord. Okay, and posterior cord comprises of all C5, C6, C7, C8 and T1. But root value of axillary nerve is not as same as that of the posterior cord. Okay, because it belongs to posterior cord, it does not mean its root values are going to be same as that of the posterior cord. Okay, its root values are, of course, that is C5 and C6. Okay, if you don't know about this, then check out my brachial plexus session. Okay, so its root values are C5 and C6. Done with the root value. Okay, there goes your 1 mark or 2 mark. Now they may ask you about its course. Okay, so in the course it goes like, okay, after coming from the posterior cord of brachial plexus, okay, it goes in the quadrangular space. It goes in the quadrangular space. Now I have taken a session about the spaces, subscapular spaces, and along with the rotator cuff muscles. Okay, so you don't know about the quadrangular space, then do check that session out. Okay, so it lies in the quadrangular space. Now in the quadrangular space, along with this particular nerve, axillary nerve, there lies another content, that is your posterior circumflex humeral artery. So it goes into quadrangular space with your posterior circumflex humeral artery. Done. Let me write the whole name only. Quadrangular space with posterior circumflex humeral artery. Okay, and here it is, I would say that here it is related to surgical neck of the humerus. Okay, related to surgical neck of humerus. Okay, it means like if you are while you are doing a surgery and you reach the surgical neck of the humerus, now you want to move towards the axillary nerve, then what side you would reach to? Then you would reach to the medial side of the surgical neck of the humerus to find this particular nerve. Okay, from the quadrangular space the nerve divides into branches. Okay, so here first of all, okay, before dividing it gives off a branch. Okay, it gives off a branch to a shoulder joint. Okay, so remember this, its first branch comes off. Okay, this is the branch that it would give off to the shoulder joint. Okay, After giving the branch to shoulder joint, okay, now remember, now this nerve runs deep to deltoid. And then divide. Okay, so what was the course? Okay, it comes from the posterior cord of the brachial plexus, then it goes into the quadrangular space with the posterior circumflex humeral artery, where it is related to the surgical neck of the humerus. Okay, here it gives off a branch. Okay, this particular branch is going to supply the shoulder joint. Okay, then it runs deep to the deltoid and then it divides. Okay, and it divides into two branches. What particular branch? You will have your anterior division and you will have your posterior division. Now, this talking about this posterior division or the posterior branch it is going to supply two muscles. Okay, it is going to supply your teres minor and it is going to supply your deltoid, but not the whole muscle, just the posterior part. Okay, and then it would continue as the upper lateral cutaneous nerve of the arm. Okay, this is the motor innervation of posterior division of axillary nerve, motor supply. Okay, but when we talk about the sensory supply of this division, okay, then it comes with the upper lateral cutaneous nerve of arm. Okay, so the posterior division, it is going to give off three branches. Okay, two will be the motor branches and one will be a sensory branch. Okay, sensory branch, and this sensory branch, it is going to supply skin over the lower half of the deltoid. Okay, so axillary nerve, two divisions, deep to deltoid, anterior division, posterior division. Posterior division, two aspect. We have the sensory aspect, we have the motor aspect. The motor aspect, it is going to supply the teres minor and the deltoid posterior part, and with the sensory aspect, it is going to supply the upper lateral cutaneous nerve of the arm. It is going to give off a upper lateral cutaneous nerve of the arm, and as the name suggests, it is going to supply the skin. Okay, because it is the sensory innervation, it is going to supply the skin over the skin over the lower half of the deltoid. Done. Now coming to the anterior division. Now this anterior division run between the deltoid and the surgical neck of the humerus with the posterior circumflex humeral vessel. I told you initially that this nerve runs with the posterior circumflex humeral vessel. Okay, so further continuing, the posterior division will not continue with this particular nerve, with this particular artery. Posterior division will go other way. Okay, this anterior division will continue with posterior circumflex humeral artery, this artery. Okay, okay, and this is going to supply only deltoid. Okay, this region supplies only deltoid. Okay, this is the motor innervation. The posterior part of the deltoid was supplied by the posterior division of the axillary nerve. This portion, the anterior division of the axillary nerve, it is going to supply the anterior part of the deltoid muscle or rest of the deltoid. Now, as same as that, it has its motor innervation, then it's similarly it will have its sensory innervation. Okay, so the sensory innervation it gives. Okay, the sensory innervation. For the sensory innervation, it gives some branches which go over the deltoid. Okay, it gives off some branches. We do not bother with the name of those branches. It gives off some branch. This was the motor supply. For the sensory supply, few branch which innervate overlying skin skin overlying the deltoid. Okay, so this is the sensory part. Okay, going through all of it once again. Root value C5 C6 easy. Now going to its course, the posterior cord, it comes from the posterior cord of the brachial plexus. It continues into the quadrangular space with the posterior circumflex humeral artery, where it is related to the medial aspect of the surgical neck of the humerus. Okay, here it gives off first branch, that is your branch to the shoulder joint. Okay, then it runs deep through the deltoid, and then it divides into two divisions, that is your anterior division and the posterior division. The posterior division gives off two muscular branches, that is going to supply your teres minor and the deltoid muscle, but the posterior region, and it also gives off a sensory nerve also. The sensory nerve is termed as the upper lateral cutaneous nerve of the arm, and it is going to supply the skin over the lower half of the deltoid. Where is the skin located? On the upper lateral part of the arm. Now coming on to the anterior division, it would run with the posterior circumflex humeral artery. Okay, then it would give off two branches. The one would be the motor branch, one would be the sensory branch. The motor branch, it would supply the deltoid, the rest of the deltoid or the anterior part of the deltoid. Okay, and for the sensory portion, you just need to remember it would give off some branches. No need to bother about their names. It would give off some branches which would supply the skin over the deltoid. Okay. Now, as you all know, we are studying anatomy, and anatomy is always incomplete without a diagram. Okay, so even if you have been asked about the axillary nerve in the 10 mark and you wrote about everything and it is pinpoint right, but you not drawn the diagram, forget it, you will not even get 7 marks. Sorry for that word, you will not even get 6-7 marks. Okay, so for to even get 6-7 marks, you need to always draw a diagram. It does not need to be beautiful. Okay, now for this diagram, consider that I am taking a cross section through the arm. Okay, cross section through the arm. Cross section to the surgical neck of the humerus. Okay, cross section through surgical neck of humerus. Okay, examiners just drawing diagram, examiners will love it, but if you show from where you taken that particular cross section or transverse section, examiner will be like, damn, this guy knows his stuff. Okay, so try to write these things also. Okay, so in this for this particular diagram, I am taking a cross section through the surgical neck of the humerus, and what do we see here? Okay, we are taking from the humerus, so of course we are going to see the humerus. Okay, there goes your humerus. Okay, now you remember your axillary artery. So this is your axillary artery. Now I told you that axillary artery, it will give off you two branches. Okay, anterior circumflex humeral artery and posterior circumflex humeral artery, and the axillary nerve runs with the posterior circumflex humeral artery. Let us consider this as the anterior aspect and this as the posterior aspect. Okay, done. So this will be our anterior circumflex humeral artery, and this will be our posterior circumflex humeral artery. Done with that? Okay, this was your axillary artery, this was your anterior circumflex humeral artery, this is your posterior circumflex humeral artery, and this is your humerus. Now coming with the nerve. Okay, so initially it runs with the axillary nerve. So here we got your axillary nerve. Now axillary nerve divides into two portions, that is your posterior division and the anterior division. Okay, so this comes your posterior division. Done. This is your posterior division. Now posterior division, as I told you, it will give off three branches. So this goes your first branch. Okay, what is this first branch? It is the branch to the teres minor. Okay, then you will have your second branch. Okay, that is your cutaneous. Right now, before drawing deltoid, I will also draw deltoid. Okay, here. So right now, for right now purposes, just remember like this. Okay, so I have three branches. This is your first branch, that is the nerve to teres minor. This is your upper lateral cutaneous nerve of the arm, and the third branch which we want is this. Okay, this is going to supply a deltoid. Right now, remember, I am going to draw the deltoid. Okay, let's just draw the deltoid first. Okay, so this is your deltoid. Okay, so this is your deltoid muscle. Okay, so this was your axillary nerve. Starting with your axillary nerve, it gives off its first posterior division. The posterior division then divides into three nerves. Okay, first nerve supplies the posterior portion of the deltoid. Second nerve, upper lateral cutaneous nerve of the arm, and third one that is going to supply the nerve that is going to supply the skin over the posterior portion of the deltoid, and the third one that is the nerve to the teres minor. Okay, this one. Now there is this one particular thing about the nerve to the teres minor is that it has pseudoganglia on it. Okay, the nerve to the teres minor has this one particular thing that it has pseudoganglion in it. Okay, this is the pseudoganglion, and this is a fact that it is not relevant for most of the nerves. Okay, you will not see many nerves with the pseudoganglion with them. Okay, so this is a fact that you should remember. Okay, just remember this particular fact. Okay, then we have your posterior branch. Now coming with your anterior branch. Okay, so this comes your anterior branch, and remember, as I told you, the anterior branch runs with the posterior circumflex humeral artery. So this is your like this. Okay, now as I told you that it is going to supply the anterior part of the deltoid or the rest of the portion of the deltoid. Okay, so this is your branch that is going to supply the anterior part of the deltoid, and let's draw one more branch here. Okay, so this is also going to supply your anterior portion of the deltoid. Apart from it, remember this one thing. Let me get another color. From this anterior branch only some branches come off. Okay, what I told you, that from the anterior division few branches divide and they innervate the skin overlying the deltoid. Okay, so these nerves will come, these branches will come, and they will supply from the anterior division. Okay, the branches will come from the anterior division and they will supply the skin that is over the deltoid. So this was all about it. Okay, now let's label the diagram, or let me give the first color coding to it. Okay, so this is your humerus. Okay, and this is your muscle. What muscle? Deltoid. Okay, so this is your deltoid muscle. Okay, so let's label these branches. Okay, so starting with, this is your axillary artery. Okay, then we have two branches on the axillary artery, that is your anterior circumflex humeral artery, anterior circumflex humeral artery, and we have your posterior circumflex humeral artery. Okay, this is your humerus. This is your deltoid muscle. Okay, now with the nerve, that is the main thing. So this is your axillary nerve. Let me get a different color for it. Let's go with green. Okay, so this is your axillary nerve. Okay, this is the posterior branch or the posterior division, and this is your anterior branch. The tracing the posterior branch. Now posterior branch gives off three branches. This is your first branch, this is your second branch, and this is your third branch. Now one branch has a pseudoganglion in it, so that would be your nerve to teres minor. Okay, and remember this fact that it has pseudoganglion in it. Okay, because they will ask you this question if you are going to give some exam on upper limb, then they will ask you that which nerve ends in a pseudoganglion or which nerve has a pseudoganglion in it. Okay, they will ask you because it is a fact based question. Okay, so this is your nerve to teres minor, and here we also have the upper lateral cutaneous nerve of the arm. Upper lateral cutaneous nerve of arm, and this is a one more division. Okay, this is going to supply the posterior part of the deltoid. Okay, and this is we have anterior branch, and in the anterior branch we have this motor nerves. This is the motor nerve, and this is your sensory nerve. So done with it. So here is your humerus, here is your axillary artery. Axillary artery divides into two arteries, that is your anterior circumflex humeral artery and posterior circumflex humeral artery. Axillary nerve runs with the, initially it runs with the posterior circumflex humeral artery, then it goes into the quadrangular space, and then from the quadrangular space it runs it runs with the posterior circumflex humeral artery. Okay, then it gives off a branch to the shoulder joint, then it runs further, then it divides into two branches, that is your anterior branch and that is your posterior branch. The anterior branch is going to give off three branches. Okay, then anterior division will give you three branches. The one branch will give to the teres minor, and it will have a pseudoganglion in it. Okay, it will also supply the posterior part of the deltoid, and along with that it will also give off a upper lateral cutaneous nerve of the arm. Okay, the anterior division will supply the rest of the deltoid, and along with that it is also going to supply the skin over the deltoid. As simple as that. It is the easiest nerve. Okay, out of all the nerves that we are going to study, axillary, take it axillary, median, radial, ulnar. This is the easiest nerve that you can think of. Okay, so in examination, if the examiner wants the paper easy, then he will go with the axillary nerve. Okay, but still it is a rare case they may ask this. Okay, so done with this. Now remaining thing, that is your clinics. Clinical anatomy. Okay, so in clinical anatomy, remember this first. Remember this. How would your axillary nerve be injured? Okay, what may be the cause for the injury of the axillary nerve? Okay, so the cause may be the inferior dislocation of the shoulder joint. The inferior dislocation of the head of the humerus. Why? Because it is lying just below the head, lying just below the capsule of the shoulder joint. Okay, remember this one thing, that this axillary nerve lies below the capsule of the shoulder joint. So if the head of the humerus is dislocated from its position, then it may damage this particular nerve. Okay, so the axillary nerve damage causes may include, first, it may include inferior dislocation of the head of humerus. Okay, or another reason may be fracture of the surgical neck of the humerus. Okay, because we know that it is in the medial aspect of the surgical neck of the humerus. So if surgical neck of humerus is damaged or it is fractured, then it may also damage the axillary nerve. Okay, fracture of surgical neck of humerus. Now if you remember its course, then you can easily, you don't have to mug this thing of then why axillary nerve could be damaged. If you remember its course, I've clearly told you that it lies on the medial aspect of the surgical neck of the humerus, and it also lies, that fact the second fact I have not told you, but you should also remember this, that it lies on the inferior aspect of the shoulder joint capsule. Okay, so where it does lie, it lies inferior to the shoulder joint capsule. It also lies on the medial aspect of the surgical neck of the humerus. Okay, so any injury that may cause interruption with these two things may also damage axillary nerve, and that is what is happening. Okay, now you know the reasons that why the axillary nerve could be damaged, but the patient will not tell you that I have inferior dislocation of my surgical neck, head of the humerus, that is why I have damaged my axillary nerve. You have to identify it, you have to diagnose it. No, this person is suffering from the axillary nerve damage. Okay, so what would be the signs that you will see? The first would be, okay, clinical representation, if I may. Okay, the clinical representation of the patient would be that he or she will not be able to do abduction. So the abduction will be impaired. Impaired abduction. Now why impaired abduction? What is the reason behind this impaired abduction? This abduction movement, it is done by your deltoid. Now if axillary nerve is damaged, then you may not have heard about this thing, this fact that there is something called as the denervation atrophy in the pathology. You are going to learn it in the next year. That it says that when a muscle is denervated, it usually atrophies. That means the muscle would shrink in size, it would become paralyzed. So if axillary nerve is damaged, then all the things that are going to be supplied by the axillary nerve, they are also going to be atrophied, or they are become useless. Okay, so the axillary nerve supplies the deltoid, and deltoid is the main abductor of the shoulder joint. So if axillary nerve is damaged, then deltoid atrophies, and if deltoid atrophies, then your impaired abduction will be there. Okay, so impaired abduction due to damage because of the paralysis of deltoid. Second would be, this is a very famous, not famous question, but a favorite question. This is your regimental badge area. Okay, what is this regimental badge area? In this area you will suffer with the sensory loss. Now, as I told you that axillary nerve not only have this motor innervation, but it also does have the sensory innervation. Where does it have? Here. Okay, it has. Where does it have? Let's go back. It has over the lower half of the deltoid. Okay, so it has a sensory innervation over the lower half of the deltoid. Okay. So as your axillary nerve is damaged, your sensory nerve will also be damaged. What is that sensory nerve? That is, sensory nerve is your upper lateral cutaneous nerve of the arm. So your upper lateral cutaneous nerve of the arm is also damaged. Damage to upper lateral cutaneous nerve. Not damage, but loss of function of upper lateral cutaneous nerve of arm. Loss of function of upper lateral cutaneous nerve of arm. Okay. So the region which will be supplied, that there will be sensory loss. So where will be the sensory loss? Over the lower skin on the lower half of deltoid. Okay, but why do we refer this to as the regimental badge area? We refer to as the regimental badge area in the armies. When you see in armies or navies or the defense services, they have their badge on this particular deltoid region only. Okay, so in this area you will suffer the sensory loss in case of the axillary nerve injury, and we refer to as the regimental badge area. Okay, and lastly, the contour of your shoulder. You see your shoulder is not like square. It is not like this. It does not have a sharp edge. It has this rounded contour. Okay, you see your shoulder are little bit round. Okay, it does have the rounded contour. They are not like this. Okay, they are not like this. They are slightly, they have contour. Okay, so there will be loss of this contour. Loss of the shoulder contour. Now why? Now this shoulder contour is lost. Okay, so beneath this shoulder contour, what do you have? Beneath this shoulder contour, you have your greater tubercle of humerus. Okay, so your shoulder contour will be lost, meaning that your deltoid will atrophize. Okay, so your deltoid is atrophied. Now deltoid, suppose your deltoid was this big. Okay, deltoid was this big. Your deltoid will become this big, and beneath this we will have your, what do we say, that greater tubercle of the humerus. So the greater tubercle of the humerus will become prominent. Suppose this, like this is your shoulder contour. Okay, and this is your greater tubercle. In the case of the axillary nerve injury, your deltoid muscle will atrophize. That is your denervation atrophy. So it will become like this. This is your greater tubercle of the humerus, and this will be the scene. Okay, this will be the scene. Now this greater tubercle of the humerus will become prominent. Okay, so greater tubercle of humerus become prominent. Okay, so these are the clinics that are associated with the axillary nerve. Okay, why the axillary nerve may be damaged? Because of the inferior dislocation of the shoulder of the head of the humerus, or for the fracture of the surgical neck of the humerus. Okay, what would be the clinical representation? It would be impaired abduction. Why? Because the deltoid is paralyzed. That would be regimental badge area, that is your sensory loss. Okay, and last, that would be prominent greater tubercle of the humerus. Okay, because the deltoid has atrophied. Apart from that, there is one more. We may say that it is related to more over to the deltoid. Okay, but you may write this off also. Okay, so site of IM injection, that is your intramuscular injection. Site of intramuscular injection. Okay, so for this intramuscular injection, we preferably have two sites, that is your gluteus maximus and that is your deltoid. Okay, what intramuscular injections do we give off? We give off tetanus toxoid. Okay, tetanus toxoid we generally give off. Okay, but we are not going to go in that much detail, but just remember this, this deltoid muscle is also a site of intramuscular region. Okay, now where do we generally give off this intramuscular injection? Okay, we give off in the lower half of deltoid. Okay, the common site for the intramuscular injection is your lower half of the deltoid. Now why do we give it here? Okay, because we have to avoid injury to axillary nerve. Okay, as you can see here in this diagram, that your axillary nerve, it winds around the surgical neck of the humerus. Okay, so as to avoid this damage, okay, we give off the intramuscular injection in the lower half of the deltoid. But this is not entirely true, because in clinical practices, we give off IM in the upper outer quadrant of deltoid. Okay, so this may be it. Okay, so learn about this particular root value. I've told about the root values, I've told about the course and its relation, I've told about the clinics and its branches and the muscular innervation by it. Okay, we are done with all these things. Okay, if you are having hard time to remember the course, okay, then just bloody go with the diagram first. Okay, if you are not able to mug up the bloody course, then don't go with the course first, go with the branches, go with the diagram first, understand this particular diagram first. And in examination, if you just drawn the diagram, then only the examiner will know that this person knows his stuff. Okay, then you don't need to write your this bloody things off. Okay, if then you may concise this whole 10 line, 15 line or 20 line to this bloody 5 lines. Okay, then also the examiner will give you marks. Okay, because he is there to pass you and he is there to give you marks only. Okay, so don't bother yourself with mugging up this bloody whole course. Just remember this diagram only. Okay, and if you want to get good marks, then write the course as well. Okay, thank you, we'll see you in the next nerves.